this morning, as the first city region to be designated as age-friendly, we wanted to launch a really important report on how older people have been coping during the pandemic. A really interesting piece of work which has been done by Manchester University, and also really interesting results from listening to the in-the-moment life experiences of over 100 people from diverse backgrounds and from a number of different organisations. And I hope many of this call will get a lot from reading that report, and also look at the actions, the further actions that we can take in pivoting what we do to a more community facing model. So just a few words of introduction from me this morning, and now I'm going to hand over to Councillor Judy Wells, who is the Assistant Portfolio Holder for Age Friendly. Jude.
Thanks, Pam, and good morning to everybody in our virtual world. A lovely day. I'm pleased to attend today's webinar to hear the findings and recommendations from this important research on the experiences of older people living in areas of multiple deprivation. And I believe this is a key issue for all us as leaders and policymakers across Greater Manchester. So I'm really, really pleased to see so many of you joining us this morning. We know that older people have been hugely impacted by the pandemic, and the report that's being shared today highlights the importance of listening to those with lived experience of older people to ensure their voices are heard, but more importantly, acted upon. So I'd really like to say welcome to everybody today, and that this is a start of a dialogue about how we collectively respond to the recommendations that this report has highlighted. And it's really, really important that we all work really well together to support older people to live well in their communities. I suppose a key message from me is the importance of investing in our communities and neighbourhoods, knowing that this report really strongly says that people working together has been fantastic. Older people have worked so well, being volunteers, supporting each other. But we know that there are inequalities in that, and that many people are finding it really hard to come to terms with coming out of COVID, and the kind of response that we're needing is really important in terms of that collective support to help people to live well. So I know that I'm really very pleased. I believe that Andy Burnham joining us now, or can somebody confirm? I don't think he's with us just yet, Jude. Okay. So I was going to obviously invite Andy to speak, and obviously he's a busy man. So I will hopefully he'll join us very soon. But basically, just today, in terms of some of the key messages that we're hoping to explore and discuss with you all, is this issue of supporting people and themselves, that kind of thing around the experience of lockdown and what it means for people and what is important. And I'm very pleased to be advised that Andy, our Greater Manchester Mayor, is on the call now. So I'd really like to welcome Andy, if he's available now, and thank him very much for joining us this morning at what I would say is a very, very important discussion. So I'd like to welcome Greater Manchester Mayor to share his response to this report. Welcome and good morning, Andy.
Good morning, Jude. Good morning, everybody. A difficult morning. I think we're all a bit in mourning this morning, aren't we? But good to be with everybody. And thank you, Jude, for that introduction. I'd just like to start by I've got the report here. Been reading it. I would just like to thank everybody who's been involved in the work. Obviously, the University, Manchester, but all of the supporting organisations who've also also fed into it. A really important piece of work in a way that I think we need to continue, to be honest. It's hearing voices that sometimes aren't heard in the way that they should be, and that's what the report is doing in its similar way in which our Disabled People's Panel did a survey coming out of the first lockdown last year. I can remember being really quite shocked in many ways by some of what came through it, just how hard things had been for people. And I think as we look to where we go from here in the recovery, I just think it's absolutely critical that we kind of understand people's lived experience of the last 18 months, and particularly the experience of people in areas of multiple deprivation. And obviously some of the impact has been greatest for older people within those areas, and that has to be at the heart of whatever we do now to come back from this. You will have probably all seen in the media just over a week ago the report that our Greater Manchester Health and Care Partnership commissioned from Professor Sir Michael Marmot, the world leading authority on health inequalities. It produced the challenging headline that Greater Manchester had suffered a death rate from COVID 25% higher than the England average. And we all know on this call that we've been living with a higher case rate pretty much all the way through the pandemic. And the message I am giving in response to that report to the government is, levelling up really has to start in the communities that have been hardest hit by COVID-19. And the reason why those communities have been hard hit is because people in those places are often living very different lives from people in the more affluent parts of the country. It is a reality that people's work is different in some of our poorest communities, is less secure. People have less ability to take time off work if they are ill or if they've been asked to self-isolate. It is also true that housing is poorest in some of those places, and the communities lack assets to improve people's health. I noticed in the report the finding about green space, and I just want to say something about that, because I think we have to put people's mental well-being at the heart of everything that we do coming out of the pandemic. And this was a call that was very much made by the Independent Inequalities Commission that we established under the leadership of Professor Kate Pickett. Promoting everyday well-being, I think, now needs to become a much kind of more important concern of all of bodies in Greater Manchester, not just our councils, but the health service, everybody working together. Later today, we will be launching the latest version of the planning framework for Greater Manchester, now under the name Places for Everyone, which is a plan of 9 of the Greater Manchester councils. But as part of that, I'm committing to a Green Spaces Fund for communities to bid to improve green spaces across the city region. And I'm not talking here about those, the big parks, which already obviously get funding. I'm talking about those pocket parks, those small bits of land that people have been using more over the last 18 months, but really could do with a bit more TLC and a bit more investment. So I'll be confirming our Green Spaces Fund later today. I know the report has talked very much about people's physical and mental deterioration over the last 18 months. And anecdotally, I see that in some of the older people around me. I think, working with our colleagues in the councils and the health service, we need to again, think differently about how we promote health and well-being on a daily basis. And I'm certainly keen to build on the community hub infrastructure that has been developed by our councils over the last year or so, and particularly how we support the organisations, the community and voluntary organisations that have been working with our councils, delivering support out of those community hubs. And in my mind, there is a thought now about how we kind of use this infrastructure to build a much more fully formed system of social prescribing, as it's called. So support for people in their communities to get daily activity, companionship from people within their local communities. It's a live well service, I think, that we need in all of our communities across across Greater Manchester, and it feels to me that this is the time to be serious about providing that everyday support, working through colleagues in the community and voluntary sector, structuring that support so that it's there on an ongoing, everyday basis in all of our communities. I just think generally we have to become much more serious about health promotion coming out of the pandemic. What it has shown to us is that too many of our communities are more exposed to poor health than others. It's why we've taken the decision to move ahead with a clean air zone for Greater Manchester. As challenging as that is, it's the right thing to do at this particular moment in time. You know, I look back as to when I was a health minister and when we had the debate about passive smoking. When you finally decide to confront an issue like that, it's amazing how quickly public opinion changes. And I think we're at the same point now with road transport. We just shouldn't tolerate the fact anymore that some of the poorest communities in Greater Manchester have to breathe in the most polluted air. We do need to become much more serious about people's health coming out of this. And hence you can see that in that decision to move ahead with the clean air zone. But of course, we want to link it to that wider health promotion drive that I was talking about, and improving our green spaces. Just picking up on some of the other issues within the report. I mean, the warning is made clear about new forms of inequality emerging post-pandemic if we continue to see delivery of services and support in the digital space, when many people do not have access to that world. Again, this is something that came very strongly through the Disabled People's Panel survey, and is coming quite clearly through this report. And the findings here, and I'll quote, highlighting that differences in the way people use technology may introduce new forms of inequality. I think this is a real risk coming out of the pandemic. If we are entering a world where more public services will be kind of left in an online context when it comes to service delivery, it follows that we have to ensure that all of our residents are equipped and empowered to access those services. We can't talk about digital inclusion anymore as a nice thing to do at some point, a sort of good thing in theory, but actually quite a low priority when it comes to the priorities of public bodies. I think we've got to get much more serious about it now. It's why I've established a digital inclusion action network across Greater Manchester, involving players from the public sector, the private sector, community and voluntary sector as well, with the aim, setting the aim for ourselves of having all under 25s, all over 75s, and all disabled people online, that we come up with personal support packages to help people either get the devices or the data connectivity they need, or perhaps more likely, when it comes to older people, the confidence and the knowledge and the skills that they need to be able to navigate the digital world. The big risk here is that we are just shutting some people out of the conversation, and we are intensifying the isolation, the social isolation that was already there before the pandemic, and that's why this issue needs to become a much bigger priority as we emerge from the pandemic. So that is something that we are also on with doing. I'll probably bring my comments to a close there in just saying finally that I think the job of recovery from the pandemic is in many ways as hard as getting through the pandemic itself. I believe the toll to be greater on people than perhaps is acknowledged, and I think the toll has not just been on obviously people's physical health, but also massively on their mental health as well, and probably we are facing a mental health pandemic right now, actually, as people come forward following the period that we've lived through. You know, I've been making the point in the media in recent days that Freedom Day for some on the 19th of July will actually be Anxiety Day for others. And I think many older people in the communities that were surveyed as part of this report will be feeling that, because I feel it's too much too soon to say that all restrictions are lifted in one go. We've got to recognise that people have been in a very different position over recent times. They have been isolating, shielding in some cases, and building back their confidence is something that needs care and attention. And to say now at this stage of the pandemic that everything is a matter of personal choice and personal responsibility, well, I don't believe that's right to frame where we are now in that context of it being Freedom Day and individual choice, because one person's choice not to wear a mask on a bus or a tram directly impinges on the physical and mental health of somebody who has an underlying health condition and has no choice but to use public transport. It isn't a purely individual decision. It's about collective health and safety. And it's why I've been making the point that we will continue to strongly encourage the wearing of masks across our public transport. And it worries me that this suggests that we're already getting, at a national level, recovery wrong. We're thinking of those voices shouting loudest to get right back out there and open everything up, and we're not thinking enough about those people who will need more support and more time to readjust to the world as it reopens. All I can say in closing is that here in Greater Manchester, we do understand that. We do understand what people have been through. That knowledge is strengthened by this report that you've provided for us. And this is what needs to guide us as we now plan our own recovery from COVID. It does need to be steady. It needs to be about giving reassurance and support for people who are going to need it, and it absolutely needs to be a collective endeavour, because it's obviously going to be a huge challenge for us all, given what we've all lived through. So Pam, I think I will leave it there. I can see you back on the screen. I will hand back to you, just if I can, in closing, thanking everybody who's been played a part in the preparation of this report, and just to give an assurance that we will take it on board and put the recommendations at the heart of everything we're doing to build back fairer from COVID-19.
Thank you, Andy, and thank you very much for your time this morning. And before I introduce Chris Phillipson, I think what you said about building back confidence and access to community resources is incredibly important, and building back confidence gradually, but making sure people do have access to digital green spaces and the things that they need to recover that confidence. So thank you very much indeed. I'm going to now introduce Chris Phillipson, who is Professor of Sociology and Social Gerontology at the University of Manchester. And Chris is going to present the findings of the report. Thank you very much, Chris.
Well, thanks very much, Pam, and thanks Andy and Jude as well. I'm grateful to my colleagues in the Manchester Urban Ageing Research Group. I'm speaking on their behalf for the support and the work that went into this report. Next slide, please. So what I'd like to do is to go through the background to the research, some of the methods we used, the research questions, and then talk about the experiences that we came across of the lockdown, and finally finish with some issues and recommendations. Next slide. I should stress that this has been very much a cooperative exercise. We've had tremendous support from a range of organisations, different organisations funding us, but right across Greater Manchester, really fantastic support, which made the research possible, and I have to say a privilege to do. And I think all of the research team really felt that to be the case. Next slide. So what were the aims of our work? Well, we wanted first to work with community organisations themselves and to look at the kind of responses to the pandemic that we were making. And we talked to a cross-section of groups across Greater Manchester. We secondly wanted to examine the impact of social distancing on people's experiences of everyday life. I mean, there are a lot of surveys around, big quantitative surveys, which have been extremely useful. But our work was trying to look in more detail of what people were experiencing. And finally, of course, we wanted to contribute to policy, local, regional and national, for organisations working on behalf of older people. Next slide, please. So the research questions were, how do older people living in or belonging to low-income communities experience social distancing? What capacities, resources do they draw upon when negotiating the experience of social distancing? How has it affected people's everyday lives? How has the pandemic really affected lives, relationships, and support networks? And what types of support services exist or could be developed to alleviate the impact of social distancing? Now, how did we go about this? Next slide, please. We did three kinds of approaches. So it took three kinds of approaches. Firstly, telephone interviews with community organisations across Greater Manchester, and these were carried out in the spring of 2020 and then followed up in winter 2021. The final interviews were in March this year. And then we had telephone interviews with people 50 plus who were identified in many cases by organisations at possible risk of exclusion. And we had 102 people, and the majority of those were interviewed on 3 occasions over May 2020 to March 2021. In other words, we followed people through, kept in touch with them, and in the majority of cases had 3 interviews with those people. I'm going to I talk about some of the interviews and quotes from them later on. People will use the interviews are anonymized, but I think they'll give you a flavour of some of the experiences that we came across. And thirdly, we had discussions with local authorities concerned with public health issues. Next slide, please. So just to say a bit about our sample, a good spread of ages and in terms of gender, fairly equal, female, male, and a good spread in terms of different age groups. So just one person over the age of 90. Importantly, we had a sample which reflected diversity. This was extremely important to us. 39 white, 48 South Asian, heritage, 15 African, Caribbean. And we're indebted to organizations from South Asian, African Caribbean community to helping us in terms of finding people to interview. Next slide, please. So a household composition, a split here between, roughly evenly between those living alone and those living with others. Although a contrast between majority of white participants living alone, majority of South Asian participants living with others, often with a partner and children. And a fairly even split as well between those in poor, fair health and those in good health. South Asian group more likely to be in poor, fair health. Next slide. So the kind of questions we asked was, how has everyday life changed? What does an everyday consist of? How have relationships changed with family, friends and neighbours? How have older people been using online or equivalent forms of communication? Those were the kind of questions we wanted to get at, to see how people's lives have changed with the pandemic over the period of time from May 2020 to March 2021 that we were able to interview people. Next slide, please. I'm going to concentrate on two areas in talking about our findings, and obviously these are looked at in much more detail in the report. Firstly, managing everyday life. How do people kind of manage 24 hours at home, as most were? And what were the challenges that people faced to physical and mental health? Next slide. Well, I think there were kind of four areas that we talk about in detail in the report, which we felt to be important from the interviews. Older people rediscovering long-standing interests was very important, finding new hobbies to keep going. But very important as well, I think, older people playing the role of befriending, supporting others, supporting other older people. That was extremely important. And volunteering as well. So, you know, important here to get a sense of older people as active participants through the pandemic within their community. Technology was important as well, although I take Andy Burnham's point here that I think one of the worries about the pandemic is that it would have accelerated divisions in terms of the use of technology. A lot of people were extremely active and creative in using technology. Others were not able to use, were denied access, were unable to use technology. And I think the gap between the two, one of our observations was that the gap between the two widened over the period of our interviewing. Religion, extremely important, I think, from our observations in terms of providing not only a structure to daily life, prayer for many, but also meaning. Religion is something that gives you a sense of what the pandemic is about, or tries to make sense of what the pandemic is about. And then finally, I'd echo the importance of green spaces, how important they were in the pandemic for many of those we interviewed. Equally, how difficult it was for those who didn't get access to green spaces during the pandemic. And I think the pandemic has really shown up the importance of prioritising this area. Next slide. One interesting finding from our study was that often people would say, I've struggled to keep up friends. You know, it's not so easy to keep friendships going when you don't see people physically, where you can't have a hug, where you can't do the sort of things that you normally do with friends. And interestingly, and this was an unexpected finding, a number of people saying they felt they'd got closer to family during the pandemic. Sharon, African British woman, says, before everybody's busy, working, doing something, but now if I phone them, they're home. Every once in a while we'll all be on Zoom and have a family evening at times and just chat and laugh and talk. That's one thing about COVID. COVID helps people to be closer. I hadn't expected that sort of comment, but you'll notice, and I think this is true of all of these quotes here, that people were using Zoom or equivalent to keep the family together. So if you don't have access to that sort of technology, it's much harder. I feel, Gasik, a Bangladeshi man, says, I feel like we have become more closer as a family, making most of the time with each other because you never know what tomorrow brings. Next slide, please. There were, though, challenges to physical and mental health. And again, Mandy has referred to these. And I'd just like to pick up 4 from our report. One, about the awareness of aging. Secondly, the impact of shielding. Thirdly, the loss of relationships. And finally, pressure on mental health. Next slide. One of the, I think, interesting findings, again, from our study was some people saying they had become more aware of themselves as an older person during the pandemic, being at home, having, being frustrated about not being able to do things, spending more time thinking about yourself. I think now, Kath says, I think now people are much more thinking about death and about how things are finite. It is just that we become more aware of it. It may be increased awareness. And Daksha says, got much older, have less energy, spend more time in bed, have nothing to do, feel really lazy now, destroyed, demotivated. And I think there's a message here, there may be an important public health message here, that coming, hopefully recovering at some point from the pandemic, we will have to support a lot of groups coming back into the community, supporting, stimulating them, encouraging them. I think that's going to be important. Next slide, please. So the next important finding in this area is the impact of shielding. Now we know from English longitudinal study of aging that shielding had a big impact on the mental health of people. And our qualitative findings really, I think, reinforce this point. Leila said, I'm not used to thinking of myself as vulnerable, but it was a bit of a shock. I don't see myself as vulnerable. The realization that I've got underlying illnesses that I need to be aware of. Well, I need to protect myself from getting or reduces the chances of getting COVID. So that was a bit of a shock. I think a very interesting comment from Leila that she didn't see herself as vulnerable before getting the letter through the post suggesting she's shielded. And similarly for Douglas, 70-year-old white man, when I read the letter, I saw the text, I actually cried. I sat there on my own and I heard about these texts going out. I thought they won't include me in this. I know I'm HIV positive, but I've no viral load and generally I'm healthy. When it said you can't leave your home for 12 weeks, I wept. The thought of that really did affect me mentally. So again, I think important message, people who've had to shield, a lot of concerns and support which they may need. Next slide. And the loss of relationships was especially important for certain groups. Sydney was a 73-year-old man who'd lost his wife a few years earlier. And in a way, the pandemic coincided with the kind of his attempts to recover from his bereavement. He was coping. My way of coping was going to these different friendship groups. And so at least I had some sort of human contact. So of course everything stopped in March, and that made me realise just how isolated I am. I didn't feel isolated before because I'd got the various groups. So for Sydney, he was made aware that his isolation was still something he had to cope with. Nikita says, my life has changed dramatically. I used to see my extended family regularly in Leicester. My daughters regularly visited me in Manchester. I also enjoyed social and leisure activities. I had a routine of going to the church and to the Gurdwara. For me, the impact has been losing the human connections, face-to-face and physical, hugs from my daughter. Nikita had long-term health problems and she was very restricted in many ways, but the pandemic had really affected her as a person with profound disabilities. Next slide, please. And then finally, just some comments on the mental health pressures. These, in some cases, coincided with other pressures on people's lives. Paula was a white woman's partner undergoing cancer treatment. She says, I'm quite a busy person. The lockdown has for me been horrible. It's been a real stress. I'm walking out, I'm just walking and crying and walking and crying. And she was trying to manage caring for her partner with the isolation as well of the pandemic. Maria says, it's an absolute nightmare. My brother died and now I have to take over my mother's health and care. It's been miserable, painful, and I've not had time to grieve. It's been physically, emotionally, and spiritually draining. I think an important point there that people having to take on new tasks, often when they've had losses themselves, and having to adjust to that, really quite difficult. Next slide. And then a final point on the mental health pressures. This is something that came up in a number of our interviews with South Asian community and women in particular. Benazir, who is a Pakistani woman living with a husband and 2 sons, she says, I look after my husband and my sons. I have carers who come and help care for my husband's needs. I don't have a social life or any hobbies, as all my time is focused on looking after them. I was struggling financially before the pandemic started. Extra care was needed for her husband. And she said the lockdown left her feeling on her own. All services were limited. This made me angry and upset. And I think, again, an issue for the future is to think about the needs of carers who certainly would have had a very tough time during the pandemic. Next slide, please. I just want to end the quotes with some examples about some of the advantages of our study in terms of looking at changes over time. This is an example from Simon, 58-year-old man who lives alone, had a limited social network before the pandemic, but he did have, he keeps himself concerned, but he did activities going to Domino's and club lunch. This is in the first lockdown, the spring interview. By the summer interview, he was saying, I'm going out more because of the Eat Out scheme, but I'm drinking about 10 cans of beer every day to make me feel better. Drink makes me feel better. It relaxes me. It would be good to have meals delivered because I'm not good at cooking. I usually have a sandwich. I don't bother with dinner either. I usually get a kebab. But then in the third interview, you can see a sense of difficulty, deterioration perhaps. I'm not coping very well, and I'm fed up with staying in. Lockdown makes me want to drink more. I drink 10 to 12 cans a day. I go to the communal garden for a bit of fresh air and meet neighbours. My next door neighbours cooked me a Christmas dinner and brought it round to me front door. I don't think I have a future. I can't see one. So he's had a really difficult time missing his groups. Next slide, please. And finally, from the interviews, Soraya was a 54-year-old Nepalese woman who lives with a husband, 3 children and 1 grandson. First lockdown, she says, all the time staying at home, so boring and depressing. Before lockdown, when we used to go out, it made us fresh, but in lockdown, staying at home all the time makes us so tense. Mostly I spend my time on cleaning and cooking. I like to spend my time praying and reciting the Quran. In the summer, she says, well, we're a bit better, but still I have this fear of coronavirus because in my family, 3 people have died from COVID-19. And my brother, sister, and my niece, they've been in hospital as a result of COVID-19. We're going to die soon. We are not going to live our lives with freedom, and life is going to be very hard. Then in the third lockdown, again, I think there's a sense of, continued deterioration in some way. Nowadays, I'm developing a new habit, which is forgetting things, as I'm diabetic with high cholesterol and blood pressure. Everything is difficult to manage, even though I'm not eating much. I really don't enjoy going out like before, and I don't have much craving to meet people. I feel like I'm getting into a dark place and want to live on my own. So, you get a sense of how things have changed for Soraya, who had a lot of caring responsibilities in the home over the period. Okay, next slide, please. So what I'd like to do now is just talk about the interviews with the organisations across GM, Greater Manchester, which we carried out, and then talk through some of the recommendations from the study. I think we were struck by the organisations we spoke to about the crucial role they really had played in supporting older people, welfare support, food distribution services, IT assistance, telephone befriending, very important, bereavement counselling, and mental health and well-being support. Next slide. But they also, I think, raised important issues in terms of the future. Certainly they felt that organisations may struggle to respond to future waves of COVID-19 without new funding. Issues of digital exclusion like to be a continuing problem, and certainly that's something we must urgently continue to address. Pressures facing equality of organisations, given the high level of demand within their various communities. Mental health issues coming out of 3 successive lockdowns, and a worry about lack of physical spaces for face-to-face contact. So people kind of, wanting to make sure community centres and other places were available for people to meet up. Well, having reflected on all of the interviews and the issues raised by community organisations, next slide, please. We came to a set of recommendations which I'd just like to conclude my presentation by going through. And in the report, we summarise this in terms of developing what we call a community-centred response to COVID-19. And it's reflected in this point from Marston and his colleague, published earlier in the year, that pandemic responses have largely involved governments telling communities what to do, seemingly with minimal community input. Yet communities can identify solutions. They know what knowledge and rumours are circulating. They can provide insight into barriers and are well placed to work with others from their communities to devise collective responsibilities. And certainly from our study, we found a lot of neighbourhood support, a lot of neighbourhood activity. And I certainly wouldn't want to underestimate that. And our recommendations are about strengthening what communities and neighbourhoods do. Next slide, please. And we think this is important because research confirms that 80% of the time people 70 and over is spent at home or in the immediate neighbourhood. So if you get the community right, if you get the neighbourhood right, if you get neighbourhood support right, then you're doing a lot to strengthen the relationships of support which older people have. Next slide. The advantages of what I see as what we see as a community-centred approach are that it may counter negative or misleading views about the effectiveness of vaccines. We think that neighbourhood-based approaches are essential because of the clustering of at-risk groups in overcrowded housing or in areas with high levels of deprivation. Community-centred approach is important because we need to convince people that their actions really can make a difference. And finally, community-centred approaches are important because we can better target isolated individuals, for example, those not using social media or the internet. So I think there are 4 very strong reasons for community approaches. And I would say here that, leaping from government centralisation to personal responsibility without really thinking about the role of communities in the middle is something that is to be regretted. Next slide. So 4 recommendations to finish. We suggest an audit of community organisations, supporting community development, promoting community participation, and recruiting community advocates. Next slide. So one suggestion is an audit or a review, which we suggest should be carried out by the Greater Manchester Asian Hub to look at the additional resources organisations are likely to need coming out of the pandemic. And I think that could usefully be linked with region-wide discussions, looking at sharing the lessons learned in responding to COVID-19, identifying gaps in support, and looking at priorities for intervention. I mean, there's no doubt that organisations have done a huge amount. But I think the issue is, if this is a longer term concern, we're looking at, potentially 2-3 years ahead, then we have to look at what is the state of organisations who've been working very hard over the last 18 months. Next slide, please. Part of this must be supporting community development. We think this issue of a community-centred approach has to really rely on strengthening communities. COVID-19, it must be said, preyed on neighbourhoods which had already been damaged by austerity and loss of what we call social infrastructure, shops, community centres and libraries. And that's why COVID-19, we've had such high rates in low-income neighbourhoods, because they'd already been damaged in many different ways. So we need to strengthen neighbourhood organisations And I think this is especially important given the impact of 3 lockdowns, which has reinforced social isolation amongst particular groups. And part of that, I think, must be strengthening. I mean, there's already a strong network across Greater Manchester of age-friendly communities. Greater Manchester has pioneered this approach, and we need to build on that. Next slide. So I think part of this must also be about promoting community participation. 5 ways of doing that. I do think we need to consolidate the mutual aid groups that have really flourished in many communities across Greater Manchester. We need to think about how we can support those over the longer term where it's appropriate. Expand what we call co-production, co-research. Again, we've had innovation in Manchester where older people are trained as researchers to reach out to more isolated older people to learn more about issues of isolation and loneliness. And that idea of co-research and co-production is something I think we can develop further. Strengthening organisations which support ageing in place. We try to encourage ageing in place, but often the places in which people age are not very supportive. And so in Manchester, we've talked about naturally occurring retirement communities. Southway have pioneered that approach, village model. But this is about collective organisation, led by organisations led by older people. And I think we have to see much more of that. We must do more to support the informal leaders within communities. Again, we've seen, I think, through the pandemic, people involved in tenants' organisations, informal leaders within communities of different kinds really step up to the mark. But they need more support, I think. They may need more assistance, more training, more financial help to continue to engage intensively within their communities. Of course, often the leaders are local councillors. And again, they've been, I think we came across really outstanding work by them as well. And expanding the range of meeting places within communities is certainly important. I think one of our strong findings is people saying how much they missed going into spaces where they could meet people face to face. And I think coming out of the pandemic, we're going to have to find those again. Our final recommendation, next slide, please. Maybe one of the most important. We face a situation, of course, where there are very high waiting lists for NHS treatment, when there are big pressures on social care, home care. And I think the concern here is that those isolated individuals in the community may be denied treatment and support if they do not have an advocate speaking on their behalf. Of course, most older people may have a convoy of support from family and from neighbours and from friends, but not everybody. And the worry is that the people who don't have that support will get pushed back to will be pushed to the back of the queue. So I think we need to look at where we get advocates from. There are no easy answers here. I think this is quite a tricky question. We're looking at it again in a seminar on Wednesday. But I think we're going to have to look at how we give isolated individuals more power to make sure they're not left behind in terms of getting access to treatment. So last slide. So I guess the key messages are that community participation is vital for developing effective responses to COVID-19. Community organisations, including those representing older people, should be co-equals in tackling the pandemic. And really, Greater Manchester should build on its experience co-research, co-production in developing a long-term response to COVID-19. Well, I'd just like to reiterate our thanks to all the participants in the research, all the organisations that really provided us with such help and enthusiasm. And I reiterate again, it was a great privilege for the research team to have their involvement. Now, we have now a short film which we're going to play before going into the discussion. Many thanks.
I want to make up for lost time to do the things I have planned before the pandemic, like traveling, so I feel positive that we will be able to do that.
Well, as soon as you start walking out and everything seems so beautiful, and as you get older, well, you always think, I wonder if I will be here when they flower again.
I use my own money to do Christmas for children in Zimbabwe. I love to build something there for them, and I'd like to have a teacher there that would be teaching them. So that's number one, building a school for them in Zimbabwe.
My daughter is going to come and take me up to York, me and the cat. I want to walk, paddle in the sea. I don't care whether it's cold or not. Once I'm there, I'm going to do it.
I am seriously going to be looking to do some voluntary work. I have just realised how empty my life is really, but it is something I can do something about. That is positive. I might volunteer at a charity shop. I could also volunteer at the cathedral and help with the beekeeping.
The future is waking up in the morning. I don't think any further ahead.
I really want to go to our holy place, Mecca and Medina. This is my biggest wish, and I hope God calls me there.
Thank you, Chris, and thank you for sharing that video with us all. And now I'm going to ask Atia Chowdhury, the chair of Manchester MBE Network, to respond to the report. Atia.
Great, thank you very much, Pam, and thank you for inviting me to this. I just want to make a few comments in terms of responding to it. First of all, I really welcome the report and the, give credit to the leadership shown at Greater Manchester level on this issue of older people and making us a more age-friendly sub-region. I'm also delighted that I was involved with the report through the community organisations I work with, and we were able to reach a lot of people. It's come at a really opportune time and critical time, I think, in that we, over the last 18 months, have been living through huge challenges with the lockdown, with the pandemic, lots of issues, lots of levels of anxiety and isolation for people, lots of losses in the community for people. And I'm really pleased that this report is coming at this time when we can respond to some of the things that have happened and how we actually move forward. I'm particularly pleased with the research team's approach that they've taken to the research, and that it is very much a bottom-up piece of work, that it involves huge amounts of lived experience, and that approach of working with the community and understanding community for me is the real essence of this report, that's where it's coming from. And we can really respond to that and have involved lots of people. I just want to maybe make 4 points around kind of my particular response, just following on from this issue, that it's very opportune, and I welcome that. That, you know, it makes a huge contribution to our policy and our understanding on this issue, and that it can inform future policy and development, particularly, as has been mentioned, the Inequalities Commission report that came out recently, and the Marmot report, that it really speaks and responds to some of the issues that have been raised within that, and can help support the system towards finding some solutions around that. And that we can really clearly focus on some of the issues that I think have come out of this, which are very specific around age, class, and ethnicity, because we do know that all those things have played hugely in terms of the disproportionate impact that we've had on those communities. And, you know, I know that very well in terms of the ethnicity disproportionate impact we've had across Greater Manchester, and particularly in Manchester. And, you know, that needs to be critically addressed. The second point I want to respond to is that, you know, many of the issues brought out have really resonated with what we understand by what's happening in community. So, you know, they're really important things to be built on in terms of how we move forward. You know, the fact that how over this period particularly, older people have physically deteriorated because of the situation that we've been living in, and we need to begin to think about that as we move into recovery, and how we begin to support you know, some of that impact that we've had. Mental health has been a massive concern and an issue, and we know that we're all talking about that potentially, you know, another crisis on our hands as we move forward. And it's not just an issue for older people. I think it's been an issue right across the communities, and we really need to think about how we respond to that and how we invest in support around that. And I'm really pleased to hear the work that Andy's referred to around the digital exclusion, and I do think that that's the other big important aspect that's come out of this report that we need to begin to think about more. And, you know, whilst many of our older people are quite digitally connected, and we did find that, there were many others who weren't, and it is going to be quite difficult for them. And that's quite a worrying aspect as we move forward into a very significant digital transformation across all services, particularly primary care and health and care, and how that's going to impact our older people. Will they be further marginalised because of that transformation, which on the one hand is absolutely something we need to do and think about, but let's not forget the people who are excluded on that. And this other big point that's come out of the report around isolation and loneliness, and how for some people, you know, that has deepened far more. And I just think about just before the pandemic, a lot of our work on this area was focused around isolation and loneliness, and how to create spaces and activity in our communities to address that. And then we suddenly go into a pandemic, and, you know, everybody's more isolated and lonely, and how people, you know, really get out of that. So investments at that local level are absolutely important. So the third point I kind of want to respond to is how, you know, fragile we have become to some extent during this crisis, and how we do need to build more resilience and sustainability, and an investment in our neighbourhoods. And, you know, this community-centred approach is absolutely critical, and how we begin to address that. So that's a massive issue. So, you know, levelling up is absolutely needed to focus on communities that have been impacted much more by inequalities, and we really need to focus our levelling up on those areas. And finally, that, you know, I do find very few services that are specifically, so I'm kind of focused around the ethnic minority communities and ethnicity in my various roles, and through this report as well, we were focusing around you know, the connection and connectivity for the South Asian communities. And, you know, we find there are very few focused activities and so in a city like Manchester, where, you know, we've got 45% plus ethnic diversity, it's absolutely important that we look at that and how we actually reach everybody in our communities. So that community level and neighbourhood level is really important. And it's absolutely critical that it works in partnership with the community sector. The neighbourhood workforce alone isn't going to be able to necessarily achieve all of that, especially as we see that there are many things that need to address neighbourhood workforce, like cultural appropriate services, language appropriate staff, people who understand their community. So, you know, it's really important that we work together on these issues. I'll leave it at that in terms of my response to the report. It's, you know, very, very welcoming of the report. I'm delighted that we were asked to be involved and were able to talk to so many people in our communities and feed into this research. And I want to just give a massive thank you to Chris Phillipson and his team for the amazing way in which they've worked with us at a community level and involved us in all the work. It's been exemplary. Thank you very much.
Thank you, Atia, and thank you for your comments. And quite rightly, this is about a community-centred response, but that's got to be sustainable, and obviously that takes resources. So thank you very much indeed. I'm now going to ask Patrick Vernon, Associate Director for Communities at the Centre for Ageing Better, to also respond to the report. Thank you.
So good afternoon, everyone. It's really great to be here, and it's really important that this report that we've supported at Centre for Ageing Better, we have a strategic relationship with Greater Manchester for the last 3 years. The work that we do at Centre for Ageing Better is looking at the whole ageing process in Britain, and our key priorities are around health, housing, employment, and the work particularly I lead on is around communities. And we have a great team in our Manchester, but Nicola, who's been our partnership manager, working with the age-friendly networks in the Greater Manchester area, and also my colleague Chris, who as part of the research team working with Manchester University and all the organisations involved in this report. This report is quite important in many ways, and it can build on the conversation we've had so far. At the heart of this report, if you do get a chance to read it, it's about inclusion, it's about equality, diversity, it's about the needs of communities who have traditionally been left behind, particularly those from Black, Asian, non-ethnic communities, older single men, and LGBT. And I think this is quite important. I mean, we have, as an organisation, over the last 18 months, been involved in sponsoring, researching, and contributing to a whole variety of research reports on the impact of COVID-19. And what's quite clear from all these research reports that come up time and time again, digital exclusion, we recognise that some people have embraced the online world, like we all are today online, but some people have struggled to embrace the online world to do with finances, lack of access, and the way that services are driven online. And there is a danger from the initial work that we've been doing and other organisations have been doing, that digital exclusion is a new discrimination barrier. So we have to recognise that, and it could be further compounded if you're from a Black and non-ethnic community. The second thing for all the research work, again, that we've identified is loneliness. As an organisation, we recognise that loneliness is important, and we're concerned about the factors and conditions that create loneliness in communities. And prior to that pandemic, loneliness was already a big issue. And we know the work of the Joseph Cox Foundation. And then later on, the government have developed various strategies, and I've been involved in some of the action planning around the government's response to loneliness. And again, what's quite clear, one, we all have different perspectives and experiences around loneliness. Loneliness is not a non-binary issue. It depends on where you are, where you live, your economic status, your ethnicity, your gender, etc. And this is quite important. And that's what's the beauty about this report. The research undertaken by the team and the lived experiences of people who are talking about their own experiences of social exclusion, discrimination, combined, wrapped up with the impact of COVID-19 and how they cope and survive is really, really critical. And I think the third factor is the issue around equality and diversity. A year ago, the whole country recognised, even though it's been there for many decades, the issue of structural racism and discrimination. And many organisations, including ours, are going through a journey of looking at our strategies, looking at our values, and saying those big questions. Are we taking seriously the issue around race, equality and diversity inclusion as an organisation? And I know that that's happening in Greater Manchester, and obviously Andy Burnham has launched the Commission on Inequalities. I know there's a race equality advisory group. So wherever you are in Britain, senior leaders in industry, chief executives of local authorities, leaders of local authorities, mayors, senior people in NHS and the voluntary sector are looking at issues of this. And I think this report is one that we've commissioned loads of reports over the years as an organisation, but this is probably one of the very first reports that we have looked at the lens of equality and ageing. And we want to do more of this work. We recognise that the intersectionality is really critical, and the report could be a real important work for Greater Manchester to build on what it's been doing for the last several years on this, but it actually is a challenge, because what's quite clear as we move out of the pandemic, and Andy Byrne talked about Freedom Day, which I am worried about, I'm concerned about the Freedom Day. Your freedom is going to be different from my freedom, and you know, for some, Freedom Day is going to be the same old, the way the experiences are. So I think it's really important that we grasp the key learning from the report, and also the report. What I found amazing about the report is that the researchers were able, working with support of voluntary community organisations and faith groups, to get those voices out there, those voices of people who are trying to survive and deal with the challenges of the impact of COVID-19, either for themselves or for their families, and it's the impact on their physical health and mental health. And this is really, really, really important and critical. It raises big issues nationally. So we hope that the levelling up agenda done by the government doesn't level down and just include and have a strong focus on race, equality and diversity. But more importantly, we want to make sure that ageing has a major impact and recognition in strategies in Greater Manchester, but more importantly, in other major core city areas and nationally as well. I'll stop there.
Thank you, Patrick. I'm just, my video won't come on, so apologies, colleagues. But I'd just like to say thank you to Patrick and to Atia for responding to that. And I just wondered, Chris, if you have got any comments before I just move into questions, having heard that response.
Well, yes, I just to pick up both Atia and Patrick. I do think that the issue of inequalities is fundamental. You know, all of the research that's come through over a range of areas has really told us one thing, that the pandemic has amplified pre-existing inequalities. Now, of course, it's easy to make that point, but I think what we're searching for now is both a language and organisations which can redress some of the way these inequalities have increased. And I think that is going to be a real challenge in the context of communities which are still being affected by austerity. So, you know, it's a combination of the pandemic, austerity, which of course has been going on for many years, and the kind of vulnerabilities which particular groups have. So it is going to be very, very tough. But I do think there are organisations in Manchester, Greater Manchester, the local authorities, that are thinking very hard about this. You know, you've seen the innovation of things like community hubs. The minority ethnic organisations have got very innovative responses. LGBT organisations have been very innovative. So I think, you know, there are great possibilities there with the age-friendly network. But this is where I think our recommendation, Pam, about having a review about the state of organisations at the present time and what they need to do, what they need in terms of resources and so on, is important.
Thank you, Chris. And that leads me on to another question which has been posted in the chat. And it's are statutory health and social care organisations geared up to working at neighbourhood rather than district and ward level? And I just wondered if you have any thoughts on that, or whether Paul has any thoughts on that, Paul McGarry. I think Paul's trying to come off mute.
Oh, hi. Thanks, everybody. I think it's John who from Stockport who posted this issue about how we work at a neighbourhood level. And I think when you peer across Greater Manchester, there is a significant level of activity, and it's different in different parts of GM. But certainly what we've been doing through our programme at a Greater Manchester level, where we have, I think, something like 53 neighbourhood projects, which were allocated a kind of mayoral award just before the pandemic, is us trying to build out from those very, very small neighbourhood community organisations that are doing work around older people and ageing. There are, of course, as well, if you like, non-geographical communities, which are important as well to bear in mind. But certainly our ambitions as we come out of COVID are to build this network or social movement, if you like, in terms of the language, of community organisations based on the work that we've done over the last few years. I think it's going to be a huge challenge for us for all kinds of reasons that have been mentioned already, but it's certainly one of our priorities.
Thank you, Paul. And one of the other questions that's been put in the chat is around next steps, and what are the next steps for this report? And I'll sort of team that with another question about how that is going to influence local authorities to commission in the right way the voluntary sector that supports the recommendations of this report. So I don't know whether Chris, you had a view on the next steps and what you would like to see.
Well, I'll just say on the behalf of the team, I mean, we are very committed to dissemination now. Obviously, today is great, and I'm very appreciative of people who've commented and the organisation. But we're absolutely committed to a strong programme of dissemination. We've got if I can plug another seminar on Wednesday, Ambition for Ageing seminar, where we're actually addressing, just to pick up a question on the chat, the issue of advocacy in more detail and trying to explore how you could actually make this work at a practical level. So I think I'm also talking GMCBO with ASIA about running workshops with the BME community in different areas, drawing on findings from the report And of course, there's the age-friendly network, which we need to work with as well. So what I'm going to really do from this discussion is work out with Paul and others good program of discussion, and Centre for Aging Better, I know, have got ideas as well. Now I think we're very committed to that.
Thank you, Chris. And I know that this report will influence the Greater Manchester strategy refresh, and it will go into that in terms of those recommendations, and they'll be a part of that refresh process. Jude, I just wondered, Councillor Wells, if you wanted to comment on the local authority and the commissioning of the voluntary sector.
Sure. Thanks, Pam. And thanks everybody for the fantastic discussions we've had today. A really, really valuable report and lots of food for thought to take away. I suppose what my kind of view is, having been in this world for many, many years, that kind of work with neighbourhoods, work at a community level is always the best thing to do. And, listening to the comments that we've had this morning from colleagues on the chat, but also in the report, is really, really food for thought about how we organise and deliver future services. And one of the things we've got locally in Greater Manchester is this new health and social care partnership, which we've had, and we have got real potential to develop our model of commissions at a very, very local level, thinking about the things that matter to people and working with our really solid voluntary sector groups to actually commission and deliver that. And I think that's one of the really key messages for commissioners today, is to think about what we do now. Is it supporting the people we need to support? Is it making a difference? Is it addressing the inequalities we know are there and are becoming more stark? And what I've read from the comments is, we've got lots of reports, and this one is actually very much an opportunity to do some positive action to kind of shape our future delivery, working really strongly across the Greater Manchester Health and Care Partnership to basically impact on change. And that's what I'd like to see as a kind of political leader of this process, in terms of trying to make a difference and actually doing things that matter to people. So that's my kind of takeaway today. Thanks, Pam.
Thank you, Councillor Wells. Atia, just wondered if you wanted to comment on the commissioning as well, and then I'll just come to Patrick, if that's all right, Patrick, around the diversity and any thoughts around commissioning around that. So Atia.
Yeah, thanks, Pam. I mean, I really welcome, the commitment being given here for the community and voluntary sector, which I think play a major role in supporting neighbourhoods and people living at that level. I do feel that we do need to support that recommendation that Chris has made in the report around the auditing and understanding better where we are, because I think that 18 months into a pandemic, I think the landscape looks very different. And I think the feeling for those of us who are bedded in the community and voluntary sector, the challenges don't really kind of align to what's being said, because many organisations, particularly supporting older people, are no longer there. They've disappeared. Their possibility of coming back is going to be really challenging. And that is so true and disproportionate for the ethnic minority sector that I work in. I know that organisations that have been running for the last 20 to 30 years are no longer there. And, we've lost a lot. So I do think that we need to be realistic and understand really from the ground and with the lived experience, that audit, so that we can place our policy and our strategy and our investment appropriately. And, I do understand where we are, investments and funding and money is going to be challenging for us. So we do need to look at the inequalities. We do need to level up where it's really going to, lower and narrow those inequalities. And this is one of those areas.
Thank you, Atia. And Patrick, I just wanted to come to you for some thoughts around that.
don't know what happened there. I pressed on mute button and wouldn't allow me. A bit like the football last night, but anyway, that's my story. I mean, the things around the report itself has got some good recommendations for Greater Manchester, which you can build on. But the heart of the matter is what's quite clear from the report, that there is a lot of goodwill out there in the community, but under-resourced, as we know. And, you know, one of the big issues, I think, for the commissioners in a place like Greater Manchester is how they're using their money in a way to empower communities. There's been lots of work done over many years around social impact assessments, value for money. The bond sector, time and time again, always is value for money, but it's never there when it comes to serious big decisions, when it comes to resourcing and commissioning. And that applies also at a national level. One of the things that I'm quite heartened was recently the National Lottery Fund, who we work closely with as well, been one of those recipients of the Work Centre. They've done a deal with an organisation called Yubele, and Yubele's worked with a whole range of BME organisations nationally called the Phoenix Way, which is a fundamental way of changing the relationship between funders and BME-led organisations. I think this is I think, you know, Manchester should adopt the Phoenix Way in all its commission models. The core cities should adopt that as well, and hopefully maybe even central governments do the same thing. But we need to change the relationship. We can't go back to the old same old where you get pittance to do 10,000 things and being undervalued. The voices, again, from the people have the permission to share their stories. We have a duty to make sure that the commissioning models work, are equitable, and meets those needs. We change that balance, the imbalance that has been there for many, many decades. And also, more importantly, that we do things differently. I mean, we're not talked about, there's neighbourhood level, but also there's the ICF level, integrated commissioning services. They're going to play a big role. They've got to really draw down at a neighbourhood level, and they've got to play a key role in as part of the health and quality agenda to do something fundamental. And also, finally, in terms of ageing in Britain, we still underinvest in ageing. And then we've still got a lot of work to do around transport, accessibility, a whole range of stuff that we need to do. So it does require a fundamental shift and a change in attitudes and perceptions as well.
Thank you, Patrick. And I'm going to close the session by saying thank you to everybody who has participated in this really thoughtful session. The report is an exemplary example of how lived experience can really inform our future thinking, but more importantly, our future actions, to make sure we really learn from the toughest of times and make sure we integrate what we've learned into commissioning in the community, by the community. And I think it's been an incredible an hour and a half and such excellent contributions from everybody. And thank you to all of you who've, I'm going to use a kind of a radio phrase, tuned in, because we really appreciate it. And this recommendation will be one of the foundations of future actions across Greater Manchester and across local authorities. So thank you to everybody and enjoy the rest of your day. Thank you very much indeed. Thank you.